Well, as you know, back in 2019, we were not actually testing for the novel coronavirus. So making that diagnosis would have been much more difficult at that time frame. However, when we do test for heart-related illnesses such as a heart attack, that's done on the basis of laboratory data as well as electrocardiographic data and classic patient history. So once we have those pieces of data in place, diagnosis can be made. So it's unlikely that we would have had someone diagnosed with a heart attack and have it not be a heart attack, whether related to a virus or ischemia at that time. Heat stroke, by its classic definition, can definitely have a negative impact on a person's heart. Usually, this will occur in patients who are probably over the age of 70 or in their middle ages. Some will have comorbidities such as underlying heart disease or lung disease, but the effects of the heat itself can cause the heart to not function well. It can cause the heart to speed up and become very fast and therefore not function very well. It could also cause your blood pressure to drop. So in settings where someone is going to be out in the heat, they need to make sure that they're in situations where they can maintain the body temperature, drinking plenty of fluids, fans or moist towels to keep themselves able to evaporate the heat from their body and prevent their body core temperature from getting elevated. Most people will have an occasional extra heartbeat, and in small amounts that is not something that's necessarily pathologic or something that needs to be treated. If you start having palpitations to the point where you're lightheaded or you're dizzy or you're having them very frequent or they're becoming lifestyle altering, then you should probably seek evaluation from initially your primary care provider and then from a cardiologist. Once again, thank you all very much for participating and submitting questions. If you have any questions or concerns, please feel free to give us a call. You can use our email address or contact us on Facebook. We'll look forward to seeing you again next quarter.